So for all of you that don't know me, I'm Dr. Stephanie Kane. I'm a foot and ankle specialist down in South Florida. Today, we're going to talk a little bit about your feet and then what kind of shoes you should be wearing. So we'll talk about some general shoes for certain pains. Remember that every person has a different type of foot type. So we want to make sure that what may work for one person may not work for another, but these are just some general advice on shoes and for some certain conditions. But I do recommend that everybody, get measured themselves, try multiple shoes out, make sure you know your size. Let's get started. So good shoes can really help ease your pain. They can increase your activity, they can change your lifestyle, and they can actually avoid surgery or other issues with your feet. Some general shoe tips are: make sure you shop and you buy your shoes at the end of the day. This is when your feet are the most swollen and when they will fit the best. Measure both your feet always, because one side is usually always larger than the other. So you want to make sure that it fits both feet. Your feet do change size over age with pregnancy, as we age. So you want to make sure that you measure as you get older. You want to make sure you measure every once in a while. You don't want to get stuck with a shoe that doesn't fit. With COVID going on, everyone's been ordering shoes offline, and the size that we've always worn may not be the same size that we've worn in the past. So we want to make sure that we do at least get fit for shoes. Don't try to wiggle. Be able to wiggle your toes in the shoes. Don't force them in. You shouldn't have pain felt in your feet. Shoes should not need a break-in period. You want to try the shoes on. So back to the whole thing, everyone ordering everything offline these days. The size that you may normally be may not even be the right size. The brand may have changed the style, or the brand in one style may be the right size, and then the other style may be the wrong size. Definitely try to take a walk around the store before you buy them. If they're not comfortable in the store, they will not be comfortable when you get home and you're walking around on them. And look for some good support in the shoes before you purchase them. You want to be able to have that kind of support. And every foot type does have a different requirement for a shoe, and that's why we're going to talk a little bit today. So according to the Institute for Preventative Foot Health, about 8% of the US, I know we have some people not in the US here, but about 8% of the US, which is about 18 million people, they suffer from flat feet. So when you have flat feet, things to look for in a shoe is good support. And that means that the arch exists in the shoes. There's no flip-flops or sandals or high heels. They really don't do that great with flat feet. You want to look for stability of the shoe. So people with flat feet, they tend to turn your ankle inward. So the shoes with stability will really help control this. And even more so than just the stability would be motion control. So you want to have some motion control. That adds even further support to control the ankle and the foot in that range of motion. So for some flat feet, and these are mostly some sneakers, some flat feet, some sneaker brands for those kind of foot types are Brooks, Asics, New Balance, Mizuno's, Hoka's, and these are all kind of good supportive shoes that are going to give you that support for a flat foot. Now, if you have a high arch foot, which is the opposite of a flat foot, obviously, that's called a cavus foot. It means that your foot is hitting the ground less. So your arch is kind of very high up. And so due to that, you actually have less shock absorption in your foot. So you want a shoe that's neutral, but you also want one that is holding the arch up. Good options are the Hoka, Cliftons, and New Balance, the Fresh Foams. Now, a lot of people suffer from plantar fasciitis. It's usually the most common cause of heel pain. And there are millions of people in the world who are dealing with this every day. With someone with plantar fasciitis, you really need a supportive instep. You want that arch support, whether it's built into the shoe or it's custom and over the counter and dispensed by your doctor. You want the arch support. Cushioning can also aid with absorption. When we talk about orthotics, we talk about two different types. One is functional and one is accommodative. You can get a functional orthotic, meaning that it controls the arch and controls the foot with the extra cushioning, so that way you can feel that support, but also have that shock absorption in the shoe. And you want a firm heel counter. And what that means is, I've got some shoes, and what that means is the back of the heel is firm. I'm not able to kind of break it down. What we also look for is that this shoe itself doesn't bend in the midfoot. This shoe is giving me good support right in the midfoot. You don't want to be able to take a shoe in and bend it in half. That's when you're not getting that support in the midfoot. That's when you're not getting that support of that shoe. So there's lots of options for shoes that do have good support that, you know, aren't sneakers. We'll look, you know, some summer shoe brands are listed here. These are, you know, sandals, open-toed, light shoes that do have an arch support or a little bit more support. Pictured here, I have the Olukai. It's a Hawaiian kind of shoe. It does have that arch support. You can see where it kind of isn't a flat as a flip-flop. You know, when we look at a flip-flop, the issue being that there is no support. It's just a flat kind of flip-flop, and then I can bend it in any which way. So when I'm walking, my toes are starting to grab the front of the flip-flop. So I'm starting to develop hammer toes and other little deformities. My arch is collapsing down, so I'm having a lot more pain. My heel is at the same level as everything else. And so these shoes really don't give us any support and can cause more issues moving forward. And then closed-toed sneakers with plantar fasciitis. If you're just starting to exercise and just starting to get back into, you know, using the sneaker, walking around, or any kind of just walking around the house, and you want a good support, a lighter weight neutral sneaker is going to be best for your foot type. But some brands are New Balance, Asics, Brooks, Hoka, On Cloud. Now bunions, a lot of people have bunions. It is so important to measure your feet, not even just if you have a bunion, but these things are called Brannock devices, and you don't really see them anymore in shoe stores. Back in the day, they used to measure everybody, left foot, right foot, measure the width, measure where, you know, where the first MPJ, which is the bunion, would kind of sit here and measure the width of the shoe. And it is super important that we're still measuring our feet and we're still using these devices to find the best fitting shoe for our foot. You want to look for a shoe that has stretch, soft material around the area of the bunion. These shoes are great. If we notice, they're all soft. They don't have that little rim of plastic around or leather around the top. There's nothing. So if you have a bunion deformity or any kind of deformity, it can kind of accommodate with the soft mesh, which is important. You want to look for something with a low heel. That'll take the body's weight from being pushed down into the toe of the shoe, so you don't feel as much bunion pain. So that is super important as well. And you want to make sure that it's wide enough to accommodate that bunion. And any kind of insole, so any kind of support, orthotics, whatever is recommended to you by your doctor. Also, you want to be able to fit into that shoe. So people always ask if like high heels can form bunion, and they actually can. And so as bunions kind of form over time, improperly fitting shoe wear can cause, like a narrow, tight heel can cause a bunion to kind of get a little bit worse over time. They're also hereditary. They can be inherited from your family. So it's really important that we do wear shoes to accommodate your foot type and also give functional support of the bunion deformities. It doesn't mean that you don't have to wear a sneaker or any kind of, you know, what patients always tell me, like ugly or old looking shoe all the time. We're really realistic about that. So there are a lot of shoe types, and even more so now, they're coming out all the time with different shoes, different accommodative, you know, they can slide an insole in, they can't. But when you do have a bunion and you're looking for a dressier shoe, you know, a lower heel. So if you're going for a special occasion, you're going to dinner, you're going to a wedding, you want to look for a shoe with a lower heel rather than a high heel. What that'll do is it'll balance out the weight. And so that way you're not putting as much weight onto the forefoot and you're not going to have as much bunion pain after. For men, it is very tough. You would think it'd be worse for women, but it's very tough to find a hard, you know, it's a dress shoe. Most of the dress shoes are harder in material. Their fabrics like leather. It's, you know, they're tight, and they're just not forgiving unless you're wearing them in. You want to make sure that you find something that has a wide toe box, that, you know, has an asymmetrical toe box that's going to allow you to alleviate that area of the bunion deformity and the forefoot. You also, a lot of people go to work and looking for work boots with wider widths. Those are narrow too, and you're squeezing your foot into those work boots. So some brands that are well known for having, you know, a little bit wider and different options are Chippewa, Timberland, Danner, Rocky, Georgia, Cat, Carolina, and Keen. Those are all options. And in any real foot, no matter what your deformity, some shoes to avoid, and I hate saying it, is high heels. They definitely put extra stress, like we talked about, on the whole body. You kind of shortens your Achilles tendon, which can shorten your plantar fascia band, which can lead to more pressure on the forefoot, which leads to more pain, more issues of plantar fasciitis. Any pointed toe shoes, they're going to squeeze them in. They're going to cause hammer toes. They're going to cause bunion deformities. They're going to cause pain and discomfort. Flip-flops, we talked about flip-flops. They just give you no support. They can cause a lot of things like tendonitis, plantar fasciitis, hammer toes from gripping the ground. Ballet flats are the same thing. They just fold. They're easy to travel with. There's just nothing to them though in giving you any kind of support. Any shoes that can bend in half, they typically they don't offer you enough support. They just kind of, they don't give you that support in the midfoot when you kind of push off the ground. Now you do want a shoe. When I say bend in half, I mean directly in half. You do want the shoe to have a little bit of motion here for that forefoot to kind of have that motion to kind of push off the ground, but nothing in the midfoot. Doesn't matter how much I push, I can't push this midfoot up. When we look at this sneaker, I can push this whole midfoot and fold it in half. And yeah, yes, these are my shoes too. So I always say to my patients, do as I say, not as I do. And then same thing with some sandals, there's just no support to them. You can find all the styles you want and all the cute. At the end of the day, you really want to make sure that you have good support to your foot. So if you do want to try other shoes and you want to try, let's say, a little height instead of a high heel, you can try wearing a wedge. It's going to give you better support, better balance. Usually they're not as high. I've seen some very high ones, but usually not as high as some of these high heels or stilettos. They're not as narrow. So that's an option. Sneakers are back in style all over. All the designers are making sneakers. So when you're out and about, maybe you try a pair of sneakers on. They're really generally very supportive for your feet and body, even the ones that have less supports than others. They really do make a huge difference. And you can wear a shoe and slide an orthotic, whether it's functional, meaning that's controlling the foot, or accommodative, meaning that it's just kind of giving you a little bit of support and a little bit of cushion in any of the shoes to really make sure that you're wearing, a better shoe than just walking around barefoot. So we're just going to go through a couple. I'll just show you a couple brands. So everyday and dress shoes. These are some brands that are pretty well known for having some good support and kind of forming to people's feet rather than, to like just the style. So you're not going to shove your foot in and really feel some pain. These are Abeo, Aetrex, Allegria, Aravon, Beautifeel shoes, Cole Haan, Clarks, Memphisto, Merrell, Naturalizer, Prophet, Stuart Weitzman, Vionics, Waldlaufer, which is a German brand, and Zayera. Zayera can actually fit orthotics in them, which is pretty neat. For men, a lot of the same ones, added in some Allen Edmonds, the Eastland Echoes. The flip-flops go both ways, actually. It should be on both, men's and women's, but flip-flops are great options too. They are flip-flop kind of shoes with an arch support. Florsheim, Johnson and Murphy, Rock Sports, Samuel Hubbard, Timberlands. In the recent years, it's been awesome because they really have developed shoes that have the backs that bend, so they slide easy on and easy off, whether it's for arthritis or post-op or mobility issues, some deformities. So these brands are ones that have been known that they can just slide in and off. So they're awesome because you don't need a shoehorn. So Zeba, Nikes, Kizik's, they all have these shoes that kind of accommodate the ability to just slide the foot in, and they do have some support to them as well. And you can always slide in another support. Some running brands that are commonly really good shoes, and they've been mentioned a couple times in this lecture, are On Cloud, Hoka's, Brooks, Asics, New Balance, Mizuno's. These are all great sneakers for anything that's going on. And then around the house. I live in Florida. I grew up walking barefoot around my house. I always tell my patients, do not walk barefoot around the house. A lot of times we spend we spend a lot of time in our house, and that's the time we're usually walking around, not thinking about our shoes, not thinking about our activity. And the most important thing is to have some comfort around the house as well. A lot of patients will choose to have a house shoe, and they'll choose maybe like an OOFOS, the Taos footwear do. Those actually have a removable footbed, and they can accommodate orthotic as well. Spenco or slides, they're great sandals as well. They do have a support. LL Bean has some slipper clogs that also have a great support there. So all important to make sure that even when we're around the house, that we do have something under our foot. We're not walking barefoot, that we're kind of comfortable, and we're giving ourselves some support. So I had a patient the other day who said this to me, and it really stuck with me. And so if you had a car and you took it into the mechanic and the treads were low, you would probably replace the tires. You wouldn't drive around on a tire that's potentially going to blow out or get flat or cause you any issues. So you only get one set of feet for your whole entire life. So it really is best that you give them the support that you can. I know that some things are cost, the cost is, huge to get involved in, or the change because you've worn something the whole time, whatever it may be. Just remember that we really want to make sure that we get the best support that we can, and we kind of treat our feet like the only ones we're going to have in our whole life, because they really are. And I think that's it. And we'll open up for some questions, whether it's about shoes or feet or anything at all. I know we always have lots of really good questions.
All right. Yes, and there's definitely some questions in here. So we can start, I guess. Rita started with, what are the best shoes for a wide shoe for walking, not too expensive?
So the expense thing is a hard one. Now you want to make sure, so any kind of sneaker that is, and I don't have a wide one here. I unfortunately don't have a wide foot. Let me see. Any kind of sneaker that's going to be soft in the front, it's going to be great for your wide foot. Now, this is a narrow.
Narrow?
This is a narrow. So even if you look at this versus like this brand, you can see the difference. It is a little bit more width to it. And these are both the same, technically the same size, same, width, but from brand to brand. So when you invest in a good brand, and it doesn't have to be too expensive, you can get them, definitely less than $100 in the 50 range, and you go a little bit wider. You want to make sure that something is soft in the forefoot.
Which brand is that gray one?
This one is a Brooks.
Brooks.
Oh, it's upside down.
What about Skechers? I know there's whole stores, and I've bought
Skechers. I actually meant to include Skechers, so I appreciate you bringing that up, because a lot of patients have loved Skechers, and in recent years, Skechers have become way more supportive and way more accommodative to different foot types. There are ones with special arch supports. There are ones, that are wide. So I definitely, Skechers have been awesome. The one downfall with Skechers is most of the insoles don't come out, so you couldn't replace it with, if you've invested in an orthotic, you usually can't replace the insole with an orthotic. But if they have the stores all over, and if you pop in and try them on and you find a wide one that works for your foot and you're going to wear it, then we love them.
Thank you.
Okay. Shirley asked, should you buy the shoe that fits the larger foot? So, if it's,
yes. Yeah. So you want your shoes to fit both feet, obviously. Your larger one is going to be the one that you are going to fit on. Now, some people have an extraordinarily different size foot, where it actually is like, half or a full size. That is very, one shoe they're just moving too much and the other one is just too tight, and they may have to accommodate and buy two different sizes. I have not tested this out since the pandemic, but Nordstrom was known because the founder of Nordstrom's wife had two different size feet. And so Nordstrom was always known to sell two different size shoes if it was necessary. So if anyone goes and tries it out and they're still doing it, let me know. But it's always good to ask that as well, because they places will make accommodations for stuff like that. But you do want to buy it for your bigger foot.
Okay. All right. And then what about, so Prima had asked, what is the cause of this always comes up, this early morning foot angle and leg cramps?
Early morning, foot, ankle, and leg cramps. Leg cramps always come up. You're right. Early morning, as in, is it waking up at night or is it bright first thing in the morning? Leg cramps usually happen due to a couple different things. One being hydration. So if it's waking up at night or first thing in the morning, you may not have stayed hydrated the day before quite as well. It also can be due to vitamin deficiencies, magnesium or calcium. It can also be due to venous insufficiency, the blood just not pumping back to the heart as well as it did before. Any of those things, usually it's more of the hydration, but can always be worked up by a doctor. You also can try quinine, so tonic water at night before you go to bed, and see if it helps with those cramps first thing in the morning as well.
Okay. And what about, we did include Dr. Stephanie's information in here, and we'll include it in a recap as well. Just, I know that Barbara was asking, so it is in the chat box. So you can jot that down. And what about there was, okay, so isn't there a new surgery to help bunions? I have a couple, this is Rose. I have a couple of foot issues, and especially on the big toes, the outside, she has pain and the soreness, even though she wears good shoes.
Rose, let me ask you, is it a new surgery that you saw advertised online?
Hold on, let's unmute.
Yes,
Yes,
Yes.
Was it called Lapiplasty?
yes.
Okay, so Lapiplasty is a and I am a Lapiplasty, I'm a Lapiplasty surgeon on their website, so I have done many of these cases. It is a three-dimensional deformity as a bunion. So we always think of it as like, oh, I have a bunion, and it just, the bone just, we take that bone and just falls right out. It doesn't. This bone
Yeah.
rotates and falls out. And so Lapiplasty is a traditional procedure called a Lapidus, which is we go back here into this joint and we fuse this joint and rotate the bone so it sits straight like this foot model is. However, Lapiplasty is a new system, taking an old procedure, making a new system. And what they do is with a jig, we kind of rotate the bone back over, and the plates kind of go on and hold this this back in place. They have their whole system, kind of the cut guides and the kind of to hold it in place and get the best correction. So it is, a three-dimensional procedure. And it does work awesome. It is very reproducible from patient to patient. There are great results with it. Then the reason I ask is they do market a lot online as a new
No,
surgery.
I saw it on television.
On television. Oh, they were in the Super Bowl, actually. I think,
Yeah.
too, someone told me. So yeah, it is a great surgery for someone who's having bunion pain, who has got, exhausted all conservative care, and they've gotten to a point where they really are considering surgery for their foot.
Well, the pain in my toes is, I get bad calluses, and I mean, they grow like almost overnight. And after 3 or 4 days, if I don't pat them or something, it's like walking on glass.
Is it in between the big toe and the little toes, or the little
No,
toe?
it's on the outside of the big toe.
Okay, so it is you're saying because the bunion is coming over, it's on the outside where the bunion kind of.
Well, the bunion is down, it is not real bad yet, but my toes have had this, and the other foot doesn't have a bunion problem. But I get it on both of my big toes, and it's like walking on glass if I don't pat it.
Oh. So it is worth seeing a doctor and seeing if there's anything that can be done. Sometimes conservatively, just kind of taking care of the calluses and the lesions there can kind of be taken care of conservatively or with certain padding, but sometimes it does end up being a surgical conversation. A lot of calluses can tell us exactly what's going on with a foot, how you walk, how you wear and tear your foot, and what kind of surgeries are best.
Well, I have high arches, and that doesn't make it easy either,
Oh.
especially getting shoes,
Yeah.
especially a size 11 for a lady.
Yep.
Well,
Anything over size, any size 10 for a female is hard.
Yeah, and to find a toe box that's big enough and that sort of stuff
A
too.
lot of patients end up going into men's, unfortunately, which they
That's what
have
I
really
have to
bad
do.
issues.
Usually that's what I have to do. All right, well, thank you very
Of
much.
course.
So Frida brought up a point. I thought walking barefoot in the home is better for strengthening our foot.
Correct. And you know, when you are young and your foot is developing, the most important thing, that's why little young kids, they wear like the little moccasins, or they tell you to walk around kind of, you know, and feel the ground. So that's the age really to kind of, you know, walk around barefoot and let them strengthen everything. As we get older, we need a little bit more support. The grounds in our houses are not very forgiving. They're not like we're walking outside on the grass, and they're usually concrete and subflooring, and they're a little bit more forgiving up north because you have, you know, you have basements that you know, it's not just concrete and then the ground, but we definitely there's a lot of pressures that are put on our foot. So it is much better in the house as we get a little bit older to have some kind of support to that foot. A lot of people choose to have like the UFOs because they say they're walking around on you know, on a cloud, or the any kind of sandals or slippers, so that way they just kind of slide it on and have a house shoe. Especially patients with plantar fasciitis will notice a huge difference once they start wearing a shoe around their house.
Okay, and so there's 3 different questions, but they're all about the same situation. So what thoughts on Uggs, Rykas, and Crocs?
Okay. Rykas, I didn't include them, but Rykas are really they're newer, I guess, kind of technology. They do have arch support. They are good shoes. They do have arch support, they do have cushioning, and they do have a lot of like soft memory foam in them. I do like them. They've been around for probably about, I don't know, 30, 40 years, but more and more people are definitely wearing them now. And they are a good supportive shoe. And they have different styles, so that's awesome. So yes, Ryka is a good shoe. Uggs, now Uggs are an interesting question because some Uggs have more support than others. Some of them are just like the foam on the bottom, and then the you know, the wool or whatnot, and then that's the leather, and that's it. And if you look at some of those boots and you wear them over time, they kind of flop around, and then they don't hold the stability. Now there are some Uggs that as we kind of increase in different styles and different, you know, costs and everything like that, there are ones that do have more of a rigid sole. They give you a little bit more support. Now Uggs do they're not like a Birkenstock where it forms to your foot as you wear it over time. It more like, you know, the wool inside kind of just like kind of
Flat.
caves down into your foot. So it's not giving you that support over time. Once in a while, those kind of shoes, no big deal. Then, you know, if they're wearing a boot, you are getting the ankle support, you're getting that control. But I didn't even think about Uggs because I live in Florida. I should have brought my pair of Uggs in and show the difference, because I can picture like just a basic Ugg boot and like how my ankle kind of collapses in, and how that boot has now formed and looks like my ankle and how I walk, because that's how it kind of, you know, wore down. And then Crocs. Crocs are okay. I say that because my son will only wear Crocs too. They're not a, you know, they're not a bad shoe in any sense. They don't have as much support as some other brands definitely do. They are great, you know, run around house shoe. They're not one that I would say wear all day, every day. They are nice that they can, you know, get wet and kind of dry. They will shrink in the sun. So if you leave them out in the sun, they can actually shrink in the sun. And then you want to make sure too that you are cleaning them, you know, once in a while, because you're just kind of in them, you can sweat in them and whatnot. You just want to make sure that you do clean them out, but they don't give as much support as some other brands do.
Okay. I'm gonna pause the chat box. I'm gonna go to some of the hands up. So Sharon, I see your hand up, and then we'll get to Doug and Rose and Martha, and then I'll get back to the chat questions. Go ahead, Sharon.
Hi, I have a question. I have a lot of problems with my foot. I broke my leg, and
Oh,
the toes are weird feeling, always tingly. And what I've noticed recently, I when I wear socks, it always feels like it's bunching up under my toes. They're not, but I have that feeling there.
Mhm.
Anything that could be done about that?
do you have any lower back issues?
Not really.
Okay. So a lot of the stuff that you're describing is nerve related. That kind of balled up foot under, or feeling under the ball of the foot, burning, tingling, numbness, shooting. And it is not uncommon after a trauma, unfortunately. Or you don't even need, if you never had the, the broken leg, you may still experience this. It could also be due to the nerves do start in the lower back, and that's why I asked about the lower back. So it could start in the lower back, or it could be local entrapment of the nerves, meaning that a nerve in the leg, whether it's from the trauma or just from wear and tear, is kind of being entrapped down and causing some of that discomfort. And then sometimes with the ball of the foot and feeling like a sock all the time, sometimes you may be experiencing a neuroma, which is an increased, inflammation along a nerve within between the foot. Usually the nerves run, I mean, they do run right in between what's called the metatarsals. And the neuroma usually is common that it kind of sits as getting kind of squeezed in there and some pressure in there, and the neuroma forms, and you feel like a constant kind of like ball, like pebble in the foot, or like a sock balled up. But it's a lot of nerve symptoms, and sometimes the sock feeling is also the start of neuropathy. And neuropathy, we commonly think of with diabetes. It is really common with alcoholism, with cancer. It's also idiopathic, meaning we have no idea where it came from. So there's a lot of things that you could work up with that, but it sounds like it's a lot of nerve related. Something easy to start with nerves is the vitamin B. So B1, B6, and B12 are neurovascular vitamins.
And she doesn't have to go back.
Neurovascular vitamins, and so there are definitely good ones to start taking.
Thank you.
Okay, Doug, if you want to unmute, Douglas? Hold on.
I have neuropathy, so I have special shoes that I have to wear. That told me that I don't see how it works that you don't lose your foot because you wear a certain shoe. That's ridiculous. I never heard of anything, a special shoe, and kind of thing. Maybe you could shed some light on what.
So I didn't talk about neuropathy as much. Let me see if I have I don't have a Plastizo insole in here, but the purpose of Medicare and insurance is covering diabetic shoes and 3 pairs of inserts for patients who have neuropathy or diabetes with neuropathy, or have lost, have bad blood flow and lost toes and whatnot. The purpose is that the insole itself is made of what's called Plastizote usually, and it's a very accommodative material. So those insoles they kind of allow you to sit and kind of not put pressure. The shearing forces are less, so you're less likely to develop calluses, less likely to develop wounds. There are certain shoes, and a lot of the ones we talked about and even more are approved for diabetics, and those shoes are usually, or with people with neuropathy who aren't diabetic as well. Those shoes are usually wider, they're more forgiving, they're not putting pressures and certain pressure points that are common to get calluses or wounds, and that's the whole reason kind of why they do cover those shoes. So do you have the insoles and the shoes?
I have the insoles and the shoes. Yeah, they had special shoes.
So the insoles are the big ones too, because they give you the 3 of them, so that way you can switch them out every 4 months. So you get them once a year. And the shoes, they want you to make sure that you're in a good shoe that's supportive, that's wide, that doesn't gonna give you the pressures and kind of irritations that they do before. I do know that even, some people say, oh, they're these whatever shoes. I had a patient that had neuropathy and got this pair of shoes actually the other day with the right insoles. So as long as it's right for your foot, then it is great for you.
Okay. And I see Martha, if you want to unmute. Go ahead.
Hello, this is my first time on.
Oh,
Okay, so what I want to talk about is my foot, both left and right feet. When I walk in the house, it's like I'm walking in water. Every room I walk, even if I go to my daughter's house and have to take off my shoes, it's like I'm walking on water. I'm walking in water. Now I have neuropathy. I'm a diabetic. And I just don't understand about the water part. I've seen a podiatrist and no one seemed to have the answer as to why it's always water. Why it feels like I'm walking on water.
Um, do you
And
feel it feels wet or just feels like,
it feels like I'm walking on water, but if I take my hand and run it under my foot is dry.
but it doesn't feel like, you don't feel like dizzy or unsteady or anything like that?
No, I stumble a lot, but I fell a couple of times, but other than that, that's it. And then my foot generates a lot of heat. I can feel heat surrounding it. And I've told the doctor about that, and they don't seem to have an answer. And then in between my toes, it always feels like something is in between my toes, but there's nothing there. I can run my fingers between my toes. There's nothing there, but that's the sensation
So,
that I
so
get.
so yeah, so there's a lot of nerve stuff. So like if you feel like water and dripping kind of feelings, or tingling, pins, needles, like something's there and it's not there, that's a lot of nerve stuff. It could be what's called paresthesia, which is like abnormal sensations. And
Mhm.
it could be due, it could have to do with the lower back, it could have to do with the lower nerves like we were talking earlier. Now, anything with the nerves, sometimes a nerve conduction study is performed, which measure, and an EMG, which measures the nerve sequences and how it sends it from the lower back all the way to the feet. So if it's something that you've had worked up in the past, it may be worth going back to the doctor and seeing if a neurologist can, kind of test that out as well, because it sounds like a lot of nerve symptoms.
Okay. Okay, I hear you, but I just don't understand why it always feel. I have to have slippers on. I just cannot walk
Yeah, that sounds like
barefoot.
a lot of nerve stuff, and without
Nerve
it
down.
able to tap on the nerves, and I can't tell you which one or what is kind of going
Okay.
on. But as long as you don't feel like you know, like you're swaying or imbalanced or anything like that, then it's
Mhm.
most likely the lower nerves.
Okay. All right. Thank you.
Of course.
Okay, I'll get back to you in 1 second, Rose. I just want to, so Gwen had asked, she often experiences numbness in her right foot. What can she do to relieve this?
So numbness is burning, tingling, numbness, again, that's all nerve stuff. It depends on where you're feeling it. Now, if you're feeling it when you put a shoe on, it's possibly that the shoe is too tight, and that you're putting pressure on it. If you're feeling it when you're sitting in certain positions, it's most likely like putting pressure on the nerves, whether it's from the lower back or local down in the leg. So you do want to kind of take a note of when you feel that numbness in the foot. It's hard to go off of just when you feel it on your right foot. If it's one-sided, it could be due to the lower back or to the local nerves in the foot.
Okay. And how about, so Eileen had asked, any thoughts on the itchy heel, raised veins on top of the foot, and noticeable blood vessels, but no foot pain? Her best sandal is Dr. Scholl's. Her mother who had foot issues would only wear SAS, but not sure if either manufacturer is still in business.
SAS is still in business, and they are actually an awesome shoe too. So I'm glad you brought that up too. They are very great shoes. The itchy heels can be coming from a couple different things. It could be, if it's dry, itching, flaking, it could be like a fungal infection, like an athlete's foot. You can try like a topical antifungal. If it's just an itchy without like any kind of visible, outside of the skin, it could be due to nerves, or it could be due to swelling and discomfort in that area. Raised veins on the top of the foot, and noticeable blood vessels, but no foot pain, sometimes or most of the time is venous insufficiency. So the arteries pump all of our blood down to our toes, and the veins pump it back up. The veins have valves, and over time those valves either like stay open, or they open too long or too short. And so over time they kind of overflow and make new routes to other veins. And we get those varicosities, the noticeable blood vessels in our legs. And the veins that we kind of see that we didn't see before. So venous insufficiency, when it does take place, can cause pain. It doesn't have to cause pain. It can cause tenderness. Most commonly, it's felt on the inside of the leg. Sometimes it's felt at the end of the day. You just kind of feel a little achy. The legs may swell up. Or sometimes it literally just is that you see the veins and that you have no issues whatsoever. And sometimes, so there's a difference between what's cosmetic, and that's just what we see. And then there's a difference between medical, which is when we're able to go in and kind of, shut down certain veins and do some procedures. But if it's not causing pain and discomfort, it's usually not a big deal at all. Now, and then the SAS. Yeah, the SAS is still in business.
Okay. So Prima had asked, well, two things. One is grounding, like walking barefoot on the earth, like grass, good for the body? Because a lot of people say to walk barefoot, like on grass outside. So
Yeah, I know they say there's a lot of restorative, healthy benefits to being outside and just feeling the ground, during the day, and it can really tension and stress and whatnot. I don't think there's any negative side effects of doing such. It's more spiritual and a more of a different side of medicine than a physical side of medicine. And I love hearing all those and learning about all of those as well. But it's definitely good to go out and do all that kind of stuff as well. It's just all the time walking on the concrete barefoot is what we're kind of talking about.
Okay. And then what causes stinging and burning sensation in lower leg and toes in the morning?
In the morning, if it's just in the morning, it may be positional from the way you slept. But the same thing, burning, tingling, numbness, stinging is nerve related. So it could be the way you kind of put pressure on your nerve, the way you sleep, could be sciatic discomfort, could just be you have local entrapment in the nerves as well. But if those are usually nerve related words.
Okay. And what's your opinion on rocker bottom shoes?
So rocker bottom shoes are commonly, prescribed to patients, things like Charcot deformities, patients with arthritis, chronic inflammation. And what a rocker bottom shoe is, it just kind of, I was going to show, it is a very durable sole, and the shoe, instead of being kind of flat or whatever, it's set like this. And so when you take a step, it more has a rock to it rather than heel to toe. And it can take pressures off a lot of, certain joints or certain ailments that you're suffering from. There are a couple different brands. I do know that Skechers has one that does have a kind of a rocker bottom to it. I think it's called the Shape Up. It does have it has memory foams, and it's a little bit comfortable in the midfoot. There are other types, Extra Steps, Hoka is a rocker bottom as well. I think their rocker bottom is the Bondi, but Hoka does have a big kind of bottom to it. But they do have advantages. It's not for everybody. So it just kind of, that's what the whole purpose of the whole lecture is, to kind of find a shoe that works for you and for your foot type. But it does offer you stability. It will alleviate pain and discomfort in certain places. And it can also help you avoid injuries, especially as we age. We fall a little bit more, we may have a little bit more pain with arthritis in our joints. And so you want something that's comfortable and gives you the stability, and it does provide that stability and can prevent, pain.
Okay. And what about Easy Spirit? Because Frida likes Easy Spirit. There's a lot of different.
There are different ones have different support. I will say that some Easy Spirits are very light. They don't offer much support to them. But if it's something you're going to wear, then it's definitely good. They have come a long way. A lot of their newer shoes do have a lot of midfoot support, and I have a lot of patients that do wear them. Some of the slip-ons also, patients are able to even get an orthotic in. But they are cost effective. They're usually around $30, sometimes more. And they do offer a little bit of support. Now you just want to always check. You just always want to check and see how much support you're getting. If you can bend it in half, you're not getting as much of the shoe that, may give you a little bit more resistance.
Okay. And neem oil. Sometimes Prima puts neem oil when she has a foot cramp, and the pain subsides within minutes. Is neem oil something that you recommend for help with that?
So I have heard that about neem oil too. I know that neem oil does help with ulcerations. It can help with GI issues. And I know that people say that it does help with like cramping and whatnot. I'm not an expert in all that like natural medicine. I will tell you that. Like I said, I'm very interested in all of it. But if it does work, it does have all those kind of symptoms to it and decreases the inflammation. So that may be exactly why it's kind of you know, working for you.
Okay, and Archana had taken a fall on ice last year, and basically she had swollen feet, and the side of her foot was swollen, and she saw the foot doctor. She did a few therapy sessions, but the pain and the swelling is still there, and it's painful still. So any suggestions on that?
Did they take x-rays is my first would be my first thing if you walked into the office, because sometimes when we have falls, slips and falls, if it hasn't gotten better in over a year, then we want to make sure, one, that there's no fracture at this point. If there was a fracture, how did it heal? Did it heal? Is it a non-union, meaning did it not heal together? The other question would be, at the time, did you have a soft tissue injury? So if you fell and all the bones were good, was there a tendon, a ligament, something that tore? And now that it's chronically kind of there and never healed properly, it just can stay, it can stay painful, it can stay swollen, it can stay with instability. And so the next step would be also to do like an MRI, if that's the case too, to take a look at all the soft tissue. So there's definitely some things that could be going on. It's not normal to have pain, you know, a year and a half after an injury. So you definitely want to get that looked at and worked up.
Okay, and what about, again, so the fastest way to get out of a rare Charlie horse or that cramp that just wakes us up and we're like, what, how do you get out of that? Like, it's just so happens to
So,
everyone.
Yeah. So beside, like, you know, if you've taken everything we can, we stay hydrated, everything is perfect, then the Charlie horse happens, because it does. Massage is usually the first thing. So kind of grabbing, you know, your calf or wherever it is and massaging it out. You can always soak in an Epsom salt bath, warm water. Heating pads can always relax muscles. So if you keep a heating pad near you, you can always put that on to relax muscles. If it's super, you know, it's still achy, you can always take like an ibuprofen or something over the counter that you usually take, but usually they stop in a couple minutes. After the fact, sometimes you still have that like achiness if it's been a really bad one. And then you can always take that ibuprofen, but usually it's just massage is the first thing, getting it moving, and it'll kind of, you know, ease off.
Okay, and I see Rose, you have your hand up, so if you want to unmute. And Tom, I'll get you right next to after Rose, so hang on there. Go ahead, Rose.
Okay, I have a problem. I sleep with a couple of blankets and my sheets, even during the summer. And sometimes my toes hurt really bad. I do have neuropathy, but I'm wondering, do you recommend using one of those, the thing that holds the blankets up off the feet?
So when we sleep, even if, you know,
And
naturally,
I sleep on my back all the time. I mean, once I go to sleep, that's where I'm at.
yeah, so when we sleep, naturally our foot kind of goes down. So if we're like, if this is my leg, if we're like this, you know, when we're up and walking, when we're sleeping, we are completely kind of what's called plantar flex, and we're relaxed. And so what that happens is that it shortens a lot of, you know, tendons, and then you add the pressure of the blanket, just like you said, and it puts even more tension on that foot. So the options being, if you're feeling that tenderness when you wake up at the end of the day, would be, you know, you can get, I think they're called like 10 lifters or blanket lifters to lift the blankets up, or you can try a night splint, which is a splint that kind of just holds the foot at more of a 90-degree angle. There's multiple different ones when you do look at them. There's ones that are big and bulky, and then there's ones that are just little socks that kind of pull the foot towards the leg, and that can kind of hold the foot in a more, you know, a stretched out position, so you're not getting all that pressure from the blankets.
Okay.
So if you definitely, you know, or I mean, the last thing you want to do is kind of pull your sheets up, because you're wearing your sheets for a reason. So usually those are the best options.
Okay, well, the other thing am asking is, I've recently started doing more exercise, and for me, that's pretty good because I was to the point I was falling quite a bit, and now I'm not. But what I do because I have neuropathy on my feet, when I get up in the morning, I work with 3 different balls to sort of get them moving. One is this little one. I start with this one.
Let me see. Okay.
Okay. And I start with rolling it around underneath the arch and the ball of my foot and all the way to the heel. I try and sort of outline my foot, and then I try and work it underneath my toes so that it's lifting them. Then I go to this one. I don't know if you can see it. It's a
Yep.
spiked ball.
Yeah,
And I use that to sort of wake up everything
Mhm.
because sometimes I don't feel much in my feet. Other times, it works. And then I do the same thing. I roll it around and get it on both feet now. And then afterwards, then I work with this ball
Okay.
and I use it by pressure and moving it back and forth sideways. Are those good exercises
Those
or?
are those are
am I-
awesome. Yeah, those are awesome. What they do is they kind of massage, they loosen up the plantar fascia band, they loosen up the small little muscles and tendons that we do have on the bottom of the foot. Especially increasing in size, you're kind of increasing different motions and different mobility. So I like all of that for definitely. It's a great way of starting your day.
Okay, thank you.
Of course.
all right, Tom, go ahead if you want to unmute.
Yes, what causes calluses on the ball of the foot? And if
So
it's gonna
callus-
happen, everything happens to my right foot.
Calluses on the ball of the foot. So usually when we see calluses on the bottom of the ball of the foot, it tells me a couple different things. It tells me that you most likely have a tight heel cord, meaning your calf and your Achilles are tight. Your plantar fascia band may be tight, and that leads to increased pain or increased pressure, to the forefoot. And so that's the ball of the foot. So you're kind of putting a little bit more pressure, a little bit more friction forces in that ball of your foot. Stretching your calf, stretching the Achilles, stretching the plantar fascia band will take some of that pressure off the ball of the foot and hopefully decrease some of the calluses. A lot of times you may need them shaved down a couple times so that you can get kind of a fresh start, but it can make a big difference.
Yeah, right now I'm suffering with a large one directly behind the large toe. And every once in a while, there's a little one that wants to start behind on the edge of the ball of foot at the little toe.
Yeah,
And,
sometimes those calluses are what's called irretractable plantar keratosis, an IPK. I won't quiz you on that word, I promise. And what that is, it's a porokeratosis. It's a clogged sweat gland. And so it becomes it's a callus, but it has a core to that callus, and it feels like you're walking on a constant pebble. So sometimes those also need to be kind of cleaned out in the deep callus of it, so that way it doesn't come back again and again.
the callus, the big one on the ball of foot is quite large. But I've been walking since 2003 using Asics, and I don't wear the same pair every day. I switch back and forth. I always buy 2 pair. And
That's the way to do it.
and normally I take the insole out and I put soft soles in, which has got, I don't know if you're familiar with them.
Yep.
But they have cushioning in the various parts of the sole of the foot. And that seems to help relieve the pressure of the pain from the large callus.
Yep.
So,
Yeah, I mean, calluses are formed because of friction forces. So, you're getting some kind of friction in a certain area,
Yeah.
and you have that increased pressure in that area. So, definitely, and you mentioned a good point, changing your shoes frequently, not wearing the same pair, all the time for as many, X amount of months is a great thing as well. It's good to change your shoes, still giving all the good support to your foot, but changing your shoes up and everything like that is
That
awesome.
comes from military days where we had to change our shoes every day, our boots every day.
Yep.
Uh, this age, I'm 80, I'll be 84 next month.
84 years young.
Yes.
Yes. Happy
And
birthday.
pandemic knocked my walking out. I used to walk 4 miles in about an hour and 10 minutes. And now it's a struggle to get 3 miles in. But we're back into walking, and it doesn't interfere. Actually, the interfering with the callus is more when I'm relaxing and sitting down and watching TV or something. But other than that, it's okay.
Well, I'm glad that you're getting up and active, and it may just be that, you're feeling them after the fact, but I wouldn't let those calluses hold you down. You know what? 3 miles, if you were doing 4 before, you're doing 3 now, that's still 3 more than, I did this morning. So you got up, you got up, you got walking, and that's what mattered.
I had a miss this morning because I wanted to tune in on this here. For the person that was talking about numbness in their foot, I had it in my right foot. Everything happens in my right foot. I had it if I was driving for a while and the foot being in one position. So I went to the podiatrist and he had me put ointment on it 4 times a day. It didn't seem for 90 days and it didn't seem to work. Then he referred me to a cardiologist, and come to find out there was a slight restriction in the circulation in the arteries, and that was the cause. So and then his aide said to take your foot, put a can of soup under it, and keep rolling it back and forth. And it seems I don't do that, but here, I kind of roll it back and forth, and it seems to aid in the circulation. So
Yep.
it was. So for that person that had a problem, they may want to check with a cardiologist and have an ultrasound done to see if they're getting proper circulation.
Yeah, anything with cramping in the feet can, or any kind of pain in the foot, or it can also be arterial or venous related. If you have any kind of blood flow issues, especially if you can only walk a couple blocks and you feel like you have to take a break because your legs feel tired or achy, or you feel like your toes are cold, or if you touch your toe and it doesn't turn white as quick as, we like to look for 3 seconds, stuff like that, you definitely want to be evaluated for any kind of arterial disease. That'll go with like an ultrasound and arterial brachial index, which is when they take a blood pressure of your ankle, of your arm, and of your toe, and they can kind of see how everything's flowing. So you don't want to mess around with anything to do with blood flow.
Yeah, for sure. And I know that just a quick that Nancy said she eats mustard when she gets Charlie horse and it works well. I don't know what the correlation is, but might want to try
I'll have to look
mustard.
that one up.
Have you ever heard that one? Yeah, that one.
I'll have to check that one out. And
Yeah. That's like Jen always said, putting a bar of soap underneath the sheets.
I think it's the acid in the mustard is my guess.
Maybe, yeah. Yeah. And when Barbara was asking, when you had flexed that shoe, if you can flex your shoe in half, does that mean that it's not good for you because it's not so supportive?
Yeah, I mean, that's that's an easy test. Take the shoe, if it bends in half, and I just, don't judge me. I just use these to run a half marathon. But if you can bend it in half, you're really not getting the support that you're getting with a shoe that just doesn't bend at all.
Yeah, for sure. So we're running short on time here. I see 2 more hands up, and these are last 2 questions because I know that Dr. Stephanie's in the office. But go ahead, Prima, and then Rose. So if you want to unmute Prima, we can go ahead and take that question.
Yeah, I just wanted to say that when I sometimes get a Charlie horse in my calf, I bend my foot and toes towards my hurt, and it relieves it.
Yep, that whole stretching and massaging, that's the easiest way to kind of get it out.
All right, and Rose, go ahead.
You said that Medicare will cover a pair of shoes and inserts.
Yep, for diabetes, with neuropathy, with a history of amputations, with a history of wounds, stuff like, and they cover one pair a year, and 3 inserts. Now, if you have a secondary and everything like that, there still may be a cost to you. It just depends on your insurances, but that's the diabetic kind of prevention program that they do have.
Okay, I'm not a diabetic, but I'm listed as pre-diabetic all the time. And I do have neuropathy.
So if
And
you
I
are
go
under-
to the foot care every 60 days because I cannot get to my feet to work on them. I have to have the caretaker take care of them, the doctor.
of course. So if you have a doctor that is managing your diabetes, I would follow up with them and see. Usually it does require a prescription from a doctor in the sense of you don't necessarily need them for diabetic shoes. You can buy the diabetic shoes, but for the insurance side of things, that they kind of have seen you, evaluated you, your last A1C, any kind of calluses, nerve damage, circulation, deformities, like all that stuff kind of falls in the ability to kind of
Okay.
get shoes. So if you go for an evaluation, they'd be able to tell you a lot more. One, if you're a candidate for it, and then 2, if they're gonna pay for it, or if you have a secondary. Everyone's insurances are a little different.
Okay, because my A1C is 4 and I'm average 90 on my sugar.
That's an awesome A1C.
I don't eat a lot of sugar. And yet they call me pre-diabetic. So I'm, it drives me crazy.
Yeah, there are strict standards. So I would just check with your doctor and follow up and see if you are a candidate for that.
Okay, well, thank you very much.
Of course.
Yeah,